Here's today's MercyOne Genesis Medical Moments.
We are continuing our discussion about memory care with Dr. Rodney Short. So, Doctor, talk to us about the different medical treatment options and some of the non-medical therapies that you guys use.
Yeah, so we have several different medical treatment options for dementia and more specifically Alzheimer's disease. There's 4 medications that have been out over 20 years. They're all pills. They help memory or cognitive functioning a little bit. They're not cures or anything, but they do help people's functioning, and there's some evidence they can help prevent behavioral problems and mood issues as well. And they're fairly safe and well tolerated, and they've been out a long time. They're inexpensive, so we do have 4 pills that are available. But we also have a couple newer treatment options that are what's called monoclonal antibodies, and this is what's really exciting about this field. Is these are 2 medications that are IV treatments that are given every 2 to 4 weeks. And they're specifically for Alzheimer's disease. And what they've been shown to do is remove the amyloid plaque from the brain that builds up with Alzheimer's disease. And these are the first medicines that we think that actually slow the progression of Alzheimer's disease. Clinical studies suggest that they slow the progression by about 30% over a year and a half of treatment. And so it's exciting times that we finally have something that slows the progression, and we need better long-term data to really know how effective they are long-term, but this is a starting point.
It is, and we've come a long way too,
yes.
for sure. How do you involve families and even caregivers in treatment decisions and even daily care?
Yeah, so treatment decisions are, it's important to have a lengthy discussion with the patient and family and see what their goals are. Again, the oral medications are fairly simple and straightforward to use, and they're not very expensive. The newer medications, these IV infusions I'm talking about, they do carry costs and risks, and people who go on these medications have to get regular MRI scans of the brain to monitor for damage to the blood vessels to the brain, because there is that risk that people can develop leaky blood vessels. So it does involve a little bit more risk and a little bit more close follow-up and visits. And so we need people to buy into making sure that they stay up on their MRIs and visits. So it is a discussion balancing the risks and benefits. But we also always talk about the non-medication treatments too, which involve lifestyle factors. The 2 big things is staying cognitively active. Keeping your brain active is generally a good idea, and whether that's doing some sort of crosswords daily, or reading, or socializing, anything that just keeps your brain active, I think is good. But particularly important is exercise. It's fairly clear that exercise is good for the brain too. And I don't think it takes a lot. I think as little as a 30-minute walk a day helps slow the rate of memory decline in people who are having memory problems. Although the more the better too.
Keep moving.
Yep. Getting people to buy into exercise and staying active is very important.
Definitely. Okay. When you talk about the treatment decisions and the personalized care, is there a case that stands out to you where a treatment plan made a real difference for one of your patients?
Well, talking about the exercise and staying cognitively active, I just saw a patient this morning who I'd first seen almost 6 years ago, who had early stages of memory problems, and she, and really it was her son and daughter who really got her to buy into the plan.
It usually is, right?
Yeah, they got her exercising. I think she's walking 45 minutes 3 days a week, and she's doing some weight training. She's going to CASI, the Center for Active Seniors, a couple days a week. And she has a neighbor friend that she plays cards with every night. So she's staying very active physically and cognitively, and she's done remarkably well. Again, I just saw her this morning. She's only declined 4 points on her mental status exam in 6 years. The average rate of decline is more 2 to 3 points per year, so she's clearly doing better than average.
That's awesome.
Yeah, and
that's really
I think
exciting to hear too.
The big thing is what she's done.
Yeah, staying active.
Yep.
Keep moving, right?
Yep.
So what advice would you give to someone who's just starting to notice memory issues in themselves or even a loved one? Staying active, obviously, right, is one of them.
Yeah, well, always talk to your primary care doctor and see if they think that it warrants further evaluation. They're usually the starting point, and if they think it's serious enough to refer to us, then they can make a referral. Although we do accept self-referrals too. People can call and make an appointment. But yeah, I mean, everyone forgets things. That's a normal part of life. And so it can be tough distinguishing what's normal forgetfulness and abnormal forgetfulness.
Yeah.
But I guess one thing I would say is that most people who are in the early stages of memory problems or dementia are not as aware of it as their family members. So it's generally going to be the family that's going to notice the problem first. And yeah, if the family is noticing clear-cut changes, then yeah, definitely something needs to be evaluated.
Yeah, time to see a doctor. Time to see you, right? Right. So how do you envision the future of treatment for conditions like Alzheimer's disease? Are there new treatments or technologies that you're excited about?
Yes, this field is as exciting as it's been for as long as I've been in it. So we have new diagnostic options. So we can actually now diagnose Alzheimer's disease based on what we call biomarkers. Basically, spinal fluid testing can fairly accurately diagnose Alzheimer's disease. And we also have what's called an amyloid PET scan, where we can visualize the amyloid in the brain that builds up with Alzheimer's. So we have those two technologies now that are fairly available. We also have some blood-based biomarkers that look very promising, and I think they're going to be the future because they're a lot easier to get than sticking a needle in someone's back for a spinal tap.
Right.
So there's some blood-based biomarkers that look very promising in terms of helping us diagnose Alzheimer's earlier and more accurately. And there's other biomarkers for the other dementias too, and not everything is Alzheimer's. There's Parkinson's related dementia or Lewy body dementia and what's called frontotemporal dementia and something called late. And so we have markers of those diseases, and I think we're going to be more and more accurate over time in diagnosing what people really have, which is important for treatment.
Yeah.
But in terms of treatment, yeah, we have for Alzheimer's, we have the first disease modifying treatments, these amyloid lowering therapies, and they do slow the progression. There's no doubt about that. How well they work long term, we're not sure. They do. Alzheimer's is really a two-pronged disease. It involves amyloid buildup in the brain, but also tau buildup in the brain, which is a different protein. And what we really probably need is a second medication to prevent the tau buildup. And there are medications in phase 3 trials that prevent tau buildup in the brain. And so I think when we have that two-pronged approach, then we're hopefully going to be really much more successful at slowing progression or even stopping progression of Alzheimer's.
Yeah.
And then the real future is diagnosing it before people even have symptoms, and I think that's going to happen eventually. Yeah, it's an exciting field. There's a lot of things going on.
Yeah, and like I said before, we've come a long way in
Yes,
this
we have.
field, for sure. So very exciting news. Thank you so much for taking the time to talk to us today about this.
Yeah, my pleasure.
All right, this was your MercyOne Genesis Medical Moments. And for more information, go to ourquadcities.com and click on the medical tab.